So now that it has been a few weeks since you had your baby, and this is your third checkup, I'm concerned that you're feeling low and that it is not getting any better. This is something that needs treatment, and I'm going to suggest a number of things for you. First, I'd like to get a bit more blood work, as you may have a thyroid imbalance, and this may contribute to how you're feeling. But if that test is normal, as I expect it will be, I do want to suggest a number of other things for you. I'm going to refer you to someone who treats illness like these in women who have just had babies. And I think that soon you will feel much, much better.
Doctor, I just don't understand why I feel like this. I feel like this should be one of the happiest times of my life, but I find myself very sad, very upset, and frankly overwhelmed.
Tell me a little bit more about how things have gone since you went home with the baby.
Well, it's been about a couple weeks, and I've just felt like crying all the time. And I don't feel the way I think I should feel. Things just don't seem right since I had the baby.
The period of time after giving birth can be a difficult one for many new moms. Rapidly changing hormone levels combined with some anxiety about doing it right when you take care of your new baby, that combined with a real disruption in your sleep, all those factors can work together to leave you feeling frankly quite overwhelmed.
It's more than overwhelmed. I feel like I'm not functioning. I'm trying to keep it together, but I'm depressed and anxious. Although I have some help, I'm getting scared because this doesn't seem to be going away.
Well, you should know that you're not alone. Nearly 80% of all new moms have some temporary feelings of low mood, anxiety, irritability, difficulty sleeping, and crying a lot. Typically, these feelings come on within 1 to 3 days after giving birth and are likely the response to the rapidly changing hormone levels that impact a woman's sense of well-being and her mood. You may have heard of this period of time being referred to as the baby blues. It's quite common for women, and as long as the symptoms come on shortly after birth and resolve within a few days, there's really nothing to worry about. And the only treatment that's needed is reassurance. However, approximately 20% of new mothers have symptoms that do continue. The symptoms last throughout the day and persist over weeks after the birth of a new baby. These moms often feel sad, maybe tearful, typically feel overwhelmed, and worry that they're not doing it right. They might also worry that something is really wrong with the baby or something is wrong with them. Some mothers have fears that they may do something wrong and actually hurt the baby, while others may also feel very guilty and become afraid that they cannot bond with their child. In some cases, the new mothers are afraid to be left alone with the baby. The majority find themselves unable to sleep well and are exhausted as a result. These more persistent mood changes are the symptoms of postpartum depression. This is a medical illness that is well recognized and is treatable with medication and support. It is, however, a condition that some mothers believe will just go away by itself if the mom only tried harder or was in some way more capable. Thinking this way may keep the mother from getting the help that she needs. The important thing is to talk to someone who can help. I'm going to suggest a number of strategies to help for you to feel better. First, I need you to get some sleep. You're really exhausted, and if this means asking your cousin, your sister, your mother, your best friend, or the baby's father to help you out at night, this is the time now. Or if you can afford it, maybe bringing someone in the evening to help you out. Second, I need you to start eating regular meals and shower and get dressed every day. At this point, you can tell your best friends that you don't need any more onesies or baby bibs or anything like that, but you really do need their help for a little bit to let you take care of yourself, to give you some time. If you're not functioning right now and feeling low at this point, it's really time to get some help. So let's talk about what kind of options might be available.
Well, I don't know that I feel comfortable taking medication.
Well, I'm concerned because from what you've told me, I really think that for you, the best thing would be a combination of medication and talk therapy.
But I do still breastfeed sometimes, and I'm concerned about the baby.
Well, that's a legitimate concern and something that we should discuss more fully. You should know there's a number of different options, many of which have a really insignificant amount of medication transferred in the breast milk. So let's talk about which option might be best for you.
While what causes depression in the postpartum time period is not entirely clear, some factors are thought to raise the risk of developing postpartum or perinatal depression. If you have one or more of these factors, a history of depression or anxiety, a family history of mood disorders or anxiety, previous postpartum depression, if you are a mom with fewer social supports, or if you have a history of smoking or substance abuse, you may be at a somewhat higher risk.
Depression in the weeks and months after delivery is a real illness. It's not something that you just have to get over. If you find that you're crying, have sleep problems, trouble eating, you're not enjoying activities or not enjoying the baby, if you find that you're worried, if you feel that you're not bonding with your baby, if you're afraid to be alone with the baby, it's time to see your doctor and to talk about the things you're experiencing. And even if none of the factors we mentioned apply to you, it's important to know that depression in the time period after having a baby is an illness that can happen to anyone. So if you find you're blue in the weeks after having your baby, you feel that you're not bonding well with your baby, you're afraid something bad will happen to the baby, you feel that you're not enjoying anything, you're crying a lot, you're having difficulty getting any rest, you're not eating properly, or you're having any thoughts of hurting yourself or the baby, talk to your doctor. There is help.
For information or to schedule a confidential appointment, please call the perinatal psychiatry specialist at the Zucker Hillside Hospital at 718-470-4MOM. That number again is 718-470-4MOM.